Hi everyone. Today we will discuss hand hygiene. Hand hygiene is the single most effective action to reduce the spread of infectious agents or germs in the healthcare. Hands are number one route of pathogen transmission. Hand hygiene is the single most effective way to prevent healthcare associated infections. Reduce healthcare associated infections including MRSA, Clostridium difficile, and vancomycin resistant enterococci, etc. Protect healthcare workers, patients, and visitors. Common healthcare associated pathogens are MRSA, that is methicillin resistant Staphylococcus aureus, Clostridium difficile, norovirus, MDRs, multi-drug resistant organisms, and influenza. All these are spread through contaminated hands. Hand hygiene is one element of standard precautions. Standard precautions are minimum infection prevention and control practices that must always be used for all patients in all situations. These are used to reduce or prevent the transmission of infectious agents and to render and maintain objects and healthcare settings as free as possible from infectious agents. What is hand hygiene? Hand hygiene is the single most effective action to reduce the spread of infectious agents in healthcare. Hand hygiene refers to action taken to clean your hands by applying alcohol-based hand rubs or hand sanitizers and washing your hands with soap and water. Soap can be non-antimicrobial or antimicrobial. Healthcare infections, HAIs, are infections acquired in the healthcare environment or during the delivery of healthcare. May develop during a patient's stay in a hospital or sometime after the patient has been discharged. This can prolong recovery, add to complications, increase care requirement, and can even lead to death. People working in or visiting in the healthcare environment are also at risk of acquiring a HAIs. When to use alcohol-based hand rubs or hand sanitizers? These are appropriate for all situations where hands are not visibly soiled and has the following advantages. It takes only 20 to 30 seconds to decontaminate hands. It is less irritating and drying for skin than soap and water. It does not require running water or paper towels to dry hands, which reduces waste and helps achieve sustainability objectives. When to use soap and water? Washing hands with soap and water when your hands are visibly dirty or contaminated, or carrying someone who has diarrhea or vomiting. Why is hand hygiene important? Because it is the single most effective action to prevent or reduce the spread of infectious agents or germs to patients and healthcare workers and limits contamination of the healthcare environment. This protects patients and yourself from healthcare associated infections. Who should perform hand hygiene? Everyone should perform hand hygiene, whether at home or in hospital or in the community, to protect yourselves and those around them. Hand hygiene is important for you because you are exposed to patients who may be colonized or infected with infectious agents or germs. Patient care equipment that may be contaminated with infectious agents or germs. Hand hygiene is required throughout the healthcare environment. The healthcare environment refers to all clinical and non-clinical spaces within an organization. For example, patient rooms and ward areas, consultation rooms, stock storage areas, waiting areas, and cafeteria areas. Hand hygiene in healthcare environment. Hand hygiene should be performed before entering the healthcare environment to minimize the risk of spreading infectious agents or germs to patients. Hand hygiene should be performed after exiting the healthcare environment to minimize the risk of spreading infectious agents or germs from the patient to yourself or other people and the healthcare environment. Healthcare environment, there are two zones where hand hygiene is critical: the patient zone and the healthcare zone. The patient zone is dedicated to an individual patient for the duration of their patient stay, including the patient, any equipment attached to the patient's immediate surroundings. Hand hygiene in patient zone should be performed before entering the patient zone to minimize the risk of spreading infectious agents to patients. Hand hygiene should be performed after exiting the patient zone to minimize the risk of spreading infectious agents from the patient to yourself or other people and the healthcare environment. The healthcare zone refers to all areas outside the patient zone, such as curtains, partitions, doors, and any shared patient area. The healthcare zone is shared by patients, healthcare workers, and visitors and may be contaminated by infectious agents or germs from these individuals. Curtains, partitions, and doors are boundary between the patient zone and healthcare zone. They are not always clean between patients and so are potentially contaminated with infectious agents or germs. Hand hygiene should be performed after touching the curtains, partitions, or doors and before touching a patient. After touching the patient or their surroundings, hand hygiene should be performed. There are 5 critical times during patient care when hand hygiene can prevent the spread of infectious agents or germs and the onset of severe illness. The 5 moments for hand hygiene are: before touching a patient, before clean or aseptic procedure, after body fluid exposure risk, after touching a patient, after touching a patient's surroundings. Moment 1. Before touching a patient. Perform hand hygiene before touching a patient. Why to perform a hand hygiene before touching a patient? To protect the patient against acquiring infectious agents or germs from the hands of the healthcare worker. The second moment is before a procedure. Perform hand hygiene immediately before a procedure to protect the patient against infectious agents or germs entering the patient's body during a procedure. Third moment is after a procedure or body fluid exposure risk. Perform hand hygiene immediately after a procedure or body fluid exposure risk to protect healthcare workers and surroundings from becoming contaminated with infectious agents or germs. The fourth moment is after touching a patient. Perform hand hygiene after touching a patient to protect the healthcare workers and surroundings from becoming contaminated with infectious agents or germs. The fifth moment is after touching patient's surroundings. Perform hand hygiene after leaving the patient zone if you have touched anything in the patient zone but not the patient, to protect the healthcare workers and the healthcare environment from becoming contaminated with infectious agents or germs. Shared clinical equipment is that this can be used on multiple patients, may be moved between patient zone and healthcare zones during patient care, is exposed to multiple patients and can be a source of infection transmission. To prevent contamination of shared clinical equipments, you should clean the equipment between each patient and before storage. Perform hand hygiene before and after using the equipment on patient. Perform hand hygiene after cleaning the equipment. Hand hygiene should be done before starting and leaving work, eating or handling food or drinks, using shared computers or mobile devices, using gloves and other items of personal protective equipment. Hand hygiene should be done after going to the toilet, blowing, wiping or touching your nose or mouth, smoking, removing gloves and other items or personal protective equipments, contact with body fluid or items potentially contaminated with body fluid, handling used linen, equipment or waste, being in a healthcare environment where there is an outbreak of an infectious diseases. How to perform a hand hygiene? There are important steps to follow when performing hand hygiene using soap and water or alcohol-based hand rubs. Using an alcohol-based hand rubs or hand sanitizer, the steps are: apply an adequate amount of alcohol-based hand rubs in the palm of your hands. Rub the hand sanitizer over all surfaces of your hands, including your fingers, fingertips, webs, thumbs and wrist. Allow your hands to dry. How to wash your hands using soap and water? Wet hands with clean running water. Apply an adequate soap to hands. Lather soap over all surfaces of your hands, including your fingers, webs, thumbs and wrist. Scrub your hands. Rinse your hands well under clean running water. Dry your hands using a clean single-use paper towel. The entire procedure duration is at least 40 to 60 seconds. Clothing, jewelry and nail treatment can harbor infectious agents that can be transferred to others, the healthcare environment and equipment. The following practical actions you can take to improve hand hygiene practices: keeping nails natural, short and clean, being bare below the elbows, that is hands and forearms are free of jewelry and clothing. Intact skin is a natural defense against infection. Dermatitis, cuts and abrasions are possible entry sites for infectious agents. Dry, irritated and damaged hands carry more infectious agents and are a risk yourself and your patients. Look after your hands. Some of the tips: avoid irritants on the skin such as chemicals, heat, dirt and sweating or moisture. Dry your hands thoroughly after washing with soap and water. Moisturize your hands regularly. Protect irritated or damaged skin on your hands with a waterproof film or dressing. Report skin problems on your hands to management. Seek professional advice if you have irritated or damaged skin. Monitoring hand hygiene in the healthcare environment helps to identify opportunities to improve hand hygiene practices, provide healthcare workers with a positive feedback when correct hand hygiene is observed, assist with monitoring the effects of hand hygiene practices on infection rates, inform and reassure patients and the community of your organization safety culture. Hand hygiene is monitored through direct observation of healthcare worker. Hand hygiene compliance is based on the 5 moments for hand hygiene: uptake hand hygiene education and training, assessment of hand hygiene techniques and or knowledge, audits of product availability, placement and usage, client or patient's experience surveys. Thank you.